Okay. All right, so we are here treating Ariana today with the Velashape 3. First thing we're going to start off with is a little lotion, and this is going to be cold at first, but this is going to help to dissipate the heat so that it doesn't get too intense. But our goal is to get the tissue nice and warm. Some would say hot. So I'm just going to spread that out. And I'm going to go ahead and explain how the Velashape works. I love this device. You get infrared heat, which comes straight out of the center, and that's going to be your superficial heat that you'll feel on the surface of your skin relatively quickly. We have a vacuum suction that is going to pull up the tissue into the device here. And then these fun little rollers are actually radio frequency electrodes. So as the tissue is suctioned up into the device, the radio frequency is delivered from one side to the other through the lower levels of the skin. So that's how we get that deeper dermal heating. So we're basically heating from the top and bottom and meeting in the middle. So our goal is to get up to about 42 degrees Celsius. Right now we're sitting at 27, so it's going to get a little warm. So we're going to start with multiple pulses in the same spot to warm the tissue up. And 42 degrees Celsius, that's going to be about 120 degrees Fahrenheit, which would be extremely hot if we didn't have any lotion and if I wasn't just constantly moving around. So I'm doing the multiple pulses at first just to get the tissue a little bit warmer. And then once it's starting to warm up here, I'll just be moving consistently. So right now we're at 37. How's it feeling?
Feels pretty good.
Feels like a deep tissue massage. I love this applicator.
Nice, warm.
I would not be surprised if you start feeling the urge to fall asleep.
I'm literally already there. Nice.
So we use this specific applicator for cellulite, also for basically any larger area that we're treating fat cells specifically. Now, if we were treating just skin laxity, we do have different applicators that don't have the radio frequency rollers. So they feel completely different. So I'm going back to doing the multiple pulses here because we are needing to heat this side up. We've already got the inner portion nice and warm.
Yeah, super relaxing.
And so what this does is it's going to increase the metabolism of the fat cells that are in the treatment area. So I like to think of it as taking a wet sponge and squeezing it out. So it's going to encourage lots of lymphatic fluid drainage. So I highly recommend drinking extra water on top of what you would normally drink in a day, just to help encourage.
Like after you get a deep tissue massage.
Yes, absolutely. Also recommend making sure that this is not the day to come in hungover, because that alcohol in your system, it's just going to make you feel super dehydrated. You're going to feel pretty crappy. All right, so we are at just about 3 minutes here. And your skin temp is hovering at about 40, just under. So the big fancy word for the Velashape, the FDA approval, is for circumferential reduction. And essentially, it's like I said, making that fat cell in the treatment area smaller by increasing its metabolism. It is not a permanent solution, but by doing the treatment repeatedly, we can maintain that increased metabolism and keep them a little bit smaller. And that's oftentimes what you might be seeing with cellulite. You have those septate bands that are holding the skin down, and then those little fat cells are just kind of peeking through. So our goal is to make them a little bit smaller. How's it feeling?
That's good.
Okay.
How often should I do it?
For the back of the thighs, I like to do weekly. Bi-weekly is okay as well. That way we're just kind of maintaining that metabolism. You can go longer in between. We definitely prefer to keep them closer together as much as possible so that we kind of keep that threshold high. So you're getting a little pink, which is to be expected, 1 from the heat and 2 from the suction. Sometimes people will bruise, really just depends on the treatment area. Inner thighs tend to be relatively sore. The chin and neck, I can almost always guarantee bruising, and that's largely from the suction. And it looks like little petechiae bruising, almost like you got a hickey. All right, we're getting nice and warm, so I'm gonna add a little more lotion here. And I heard a ding for the 5-minute time frame.
So how long on each side usually?
The treatment is 15 minutes clock treatment per area. So some people will do, depending on the size of the treatment area, a thigh could be 1 full area on its own, or it could be split in half. It really just depends. It's super individualized with regards to how big or small the treatment area is. And that goes for arms, that goes for abdomen. The thing with this treatment is we do only have like 15 minutes. So the larger an area we're attempting to cover, the more the heat is going to be essentially spread out. So we want to get the treatment area up to that 40, 42 degree threshold and maintain it for as long as possible. So if we were to take that 15 minutes and try to spread it all over to different places, then that's when we're just basically doing a subpar treatment. So you really want to make sure that you're getting the biggest bang for your buck. So we are at 42, we are holding steady, and that's essentially the threshold that they came up, that's my new favorite word today, threshold apparently. That's the number that came from clinical trials that show that's when we are going to be seeing a difference.
After an evening,
What was
after 3.
Sorry?
What was it after how many that you can start to see a difference?
Oh, well, I was talking about like the specific temperature that we want to get it up to.
Oh, right.
Typically, it's after the 3rd treatment, and that's because it takes anywhere from 6 to 8 weeks to see full results from a treatment. So we typically say the 3rd because that's when you start to see the results from the first one, because it's usually about 6 weeks that we have that scheduled at. Right, do a little more lotion here. So I love this treatment for especially like skin laxity, cellulite. This absolutely helps. It's not going to permanently get rid of dimples. So we typically will use this in conjunction with, there's so many options, Subcision, Quo. Oftentimes we'll do this treatment after Cool Sculpt or liposuction because it's going to help to tighten up the tissue once those fat cells are gone. So it really has a lot of different ways that we can utilize it. It's a really neat tool that we have because we can use it for so many different things. And the treatment protocols just vary based on what our goal and focus is. Okay, so we're gonna go ahead and finish up with the other thigh here in a moment. And as you can see, we've got a nice pink tone. The skin always looks so hydrated with that cream on afterwards. And you'll start to see results typically by the third treatment. It takes anywhere from 6 to 8 weeks to see full results. So we'll check back in with you at that point in time. We're gonna go ahead and finish the other side here. Subscribe, follow us, you know, all the different social medias that we are on, and we'll be seeing you soon.